What are the symptoms of bile acid malabsorption and how is it diagnosed? Have you ever wondered what happens when your body struggles to absorb bile acids? This can lead to a condition known as bile acid malabsorption. It is especially important for those with sensitive stomachs, like individuals with irritable bowel syndrome or colitis. Let's break down the symptoms and how this condition is diagnosed. The main symptom of bile acid malabsorption is chronic watery diarrhea. This occurs because unabsorbed bile acids in the large intestine cause the colon to release more fluid and increase muscle contractions. As a result, you may find yourself rushing to the restroom more often than you'd like. Along with diarrhea, you might experience a sudden and urgent need to use the restroom. This can be quite distressing. Bloating is another common symptom, which can leave you feeling uncomfortable and swollen in the abdomen. Abdominal pain, often cramp-like, can also occur and may be severe for some individuals. Excessive flatulence, which can be quite smelly, is another symptom to watch for. Some people even experience nocturnal defecation, meaning they wake up during the night to use the bathroom. In some cases, individuals may face incontinence, which is the loss of control over bowel movements. Now, diagnosing bile acid malabsorption can be a bit tricky. There are several methods healthcare providers may use to reach a diagnosis. One common approach is the Southeast CAT scan. In this nuclear medicine test, a capsule containing an artificial bile acid is swallowed. Scans are then performed to see how much of this bile acid is retained in the body over time. Another method is the fecal bile acid test. This involves collecting stool samples over a period to assess bile acid levels. Sometimes, healthcare providers make a clinical diagnosis by ruling out other conditions that could cause similar symptoms. They may also observe improvement with medications used to treat bile acid malabsorption. For those with sensitive stomachs, like individuals with irritable bowel syndrome or colitis, it is essential to work closely with healthcare providers. Accurate diagnosis and management of bile acid malabsorption can be key in alleviating symptoms and improving overall digestive health. Understanding these symptoms and diagnostic methods can help you take charge of your health and seek the right support when needed.